Good morning, everyone. I will call the subcommittee meeting for Human Services joint meeting to order. Could the committee secretary please call the roll?
Senator Canizaro. Senator Dondero Loop. Here. Senator Hammond. Here. Senator Keykeeper. Here. Senator Ratty. Here. Assemblywoman Benitez Thompson.
Here.
Assemblywoman Carlton.
Here.
Assemblyman Frierson. Assemblyman Roberts.
Here.
Assemblywoman Titus.
Here.
Assemblywoman Tolles.
Here.
Assemblyman Watts.
Here.
Chair Monroe Moreno.
And I am here. If you will mark Assemblyman Frierson present when he arrives. I know he'll be running late. All other members are present. Today we will be having budget closings for the Department of Health and Human Services, Division of Public and Behavioral Health. If the building is on limited openings, so there's still a number of people joining us by Zoom or by phone. Please know that there will be public comment at the end of today's meeting. We thank you all for joining us, no matter how you're joining us today. It's a pleasure to see you. And with that, we will start with our first budget closing.
Thank you, Chair. For the record, Christian Tower, LCB Fiscal Analysis Division. Beginning with the Behavioral Health Administration budget, which committee members will find on page 3, starting in the closing package. There are no major decisions before the subcommittee in this budget. On page number 4, the subcommittee will find 2 other closing items. Other closing items number 2 is a technical adjustment to the base budget. The contract costs for the Nevada Psychology Internship Consortium were by mistake budgeted too high. The technical adjustment would reduce these costs to the proper amount. Fiscal staff recommends other closing item 1 be closed as recommended by the governor, and other closing item 2 be closed as a technical adjustment and request authority for staff to make other technical adjustments as necessary.
Thank you. Members, do you have any questions or comments on this budget closing item? Seeing none, I'll call for the motion.
I'd like to make a motion that closing item 1 be closed as recommended by the governor and other closing item 2 be closed as a technical adjustment and request authority for staff to make other technical adjustments as necessary.
Thank you, Senator Ratty. And second?
Second,
A second from Assemblywoman Benitez Thompson. Any discussion? Seeing none, all in favor of the motion, please say aye. Aye. Any opposed? Motion passes.
Thank you, Chair. Moving on to problem gambling budget on page 7 in the closing package. There's one major decision before the subcommittee, beginning on page 8. The governor recommends general fund reductions of $176,000 in each year of the upcoming biennium. And these would be a reduction of funds that the agency uses to support prevention, treatment, research, and other activities to address problem gambling. On page 9, the decision before the committee. Does the subcommittee wish to recommend a reduction of general fund appropriations of $176,000 in each year of the 2021-23 biennium, as recommended by the governor?
Thank you. And before we go any further, let the record show that Speaker Frierson and Majority Leader Canizaro are here and present. Members, any questions or comments on this budget closing item? Assemblywoman Tolles.
Thank you, Chair. I just want to make sure I'm on the right page. I thought I heard you say that it's a $176,000 reduction for each year, but on my page it says $91,749. I'm just wondering if I'm looking at the wrong thing or reading it incorrectly.
Are you on page 9?
Yes, I am on page 9, or I'm on page 7, so that's for, so problem gambling, okay, page 9. I'm still, sorry, give me just a second. Okay, there, I see it. Thank you, Madam Chair, my apologies.
No problem. Any other questions or discussions? Seeing none, I'll ask for the motion.
I'd make a motion to recommend a reduction in general fund appropriations of $176,000 in each year of the 2021-2023 biennium as recommended by the governor.
Thank you, Senator Ratty. And a second? Second. A second by Assemblywoman Carlton. Any discussion? Seeing none, all in favor of the motion, please say aye. Aye. Any opposed? Motion carries. Thank you.
Thank you, Chair. On page 9, the subcommittee will find 2 other closing items for this budget. Other closing item number 2 has a technical adjustment. The transfer of a general fund supported position did by mistake result in these position costs being expended twice out of this budget. The technical adjustment would correct this error, resulting in general fund reductions of more than $90,000 in each year. Fiscal staff recommends other closing item 1 be closed as recommended by the governor, and other closing item 2 be closed as recommended by the governor, with the noted technical adjustment, and request authority for staff to make other technical adjustments as necessary.
Members, any discussion on the other closing items? Senator Ratty?
I recommend that other closing item 1 be closed as recommended by the governor, and other closing item 2 be closed as recommended by the governor with the noted technical adjustment, and request authority for staff to make other technical adjustments as necessary.
Second? Second. I have a second from Assemblywoman Carlton. The motion is made by Senator Ratty. Any discussion on the motion? Seeing none, all in favor? Aye. Any opposed? Motion carries. Moving on.
Thank you, Chair. Christian Tau for the record. Moving on to the behavioral health prevention and treatment budget from page 11 on. There are 3 major decisions before the subcommittee. Major decision 1 begins on page 12 of the closing package. It concerns the conversion of 4 full-time contractor positions to 3 full-time health program specialist and 1 full-time administrative assistant positions. The positions would continue to be grant funded. Funding is expected to be available in perpetuity. The agency states that the positions fulfill core duties under the federal grant. Does the subcommittee wish to recommend approval of the conversion of 4 contracted positions into 1 administrative assistant and 3 health program specialist state positions as recommended by the governor?
Members, any discussion? Seeing none, Senator Ratty?
I would like to make a motion to approve the conversion of 4 contracted positions into 1 administrative assistant and 3 health program specialist state positions as recommended by the governor.
Thank you. A second? Second. And a second from Assemblywoman Carlton. Any discussion on the motion? Seeing none, all in favor, please say aye. Aye. Any opposed? Seeing none, motion passes. Moving on.
Thank you. The second major decision in front of the subcommittee can be found on page 13 and concerns the transfer of the Office of Suicide Prevention, inclusive of 4 positions, to this budget from the Maternal, Child, and Adolescent Services budget. The transfer is hoped to increase the competitiveness of the Office of Suicide Prevention in federal grant applications. There's a technical adjustment to the recommended action. Portions of the fund to support the Office of Suicide Prevention were by mistake left in the Maternal, Child, and Adolescent Services budget. The technical adjustment would correct this to ensure that the Office of Suicide Prevention is transferred in its entirety to this budget. Does the subcommittee wish to recommend approval of the transfer of the Office of Suicide Prevention to the Behavioral Health Prevention and Treatment budget, including 4 permanent positions, as recommended by the governor, and with the noted technical adjustments.
Thank you. Members, any questions or comments on this budget closing item? Seeing none, Senator Reddy?
I wish to recommend approval of the transfer of the Office of Suicide Prevention to Behavioral Health Prevention and Treatment budget, including 4 permanent positions as recommended by the governor with the noted technical adjustments.
Thank you. It's been motioned by Senator Reddy, second by Assemblywoman Carlton. Any discussion? Seeing none, all in favor of the motion, say aye.
Aye.
Any opposed? Motion carries. Moving on.
Thank you, Chair. Major decision number 3 on page 14 of the closing package concerns additional COVID-19 federal grant supplements. Major decision number 3 would add $14.2 million in additional federal COVID-19 funds to this budget in 2022 and $8.7 million in fiscal year 2023. It consists of 2 measures. First measure concerns Decision Unit E490 in the executive budget, which recommends eliminating an expiring COVID-19 emergency grant. On January 15, 2021, the agency received notice of an expansion and extension of this COVID-19 emergency grant supplement. Acceptance of this new grant supplement was approved by the Interim Finance Committee on its April 1st, 2021 meeting. The technical adjustment would add $2.1 million of these newly received additional grant award to this budget in fiscal year 2022. Given the expiry of the grant by the end of fiscal year 2022, the new grant, the decision unit would remain for fiscal year 2023, eliminating this grant in 2023. The second measure concerns Budget Amendment A215-743170. This amendment would add $12.3 million in federal substance abuse prevention and treatment and community mental health services block grant COVID-19 emergency relief funds in fiscal year 2022 and $8.7 million in 2023. Does the subcommittee wish to recommend approval of, first, Decision Unit E490 with a noted technical adjustment in fiscal year 2022 to increase SAMHSA COVID-19 grant authority to $2.1 million to include a recent supplemental grant award, with a grant being eliminated in fiscal year 2023. And secondly, the governor's recommended budget amendment A215-743170, which adds $12.3 million in federal SAPT and CMHS coronavirus relief funds to this budget in 2022 and $8.7 million in 2023.
Thank you so much for that. Before we go to the motion and other questions, I know there's a few members with questions. I believe there's the administrator from the department joining us. Could you just give us a little more detailed information about the expansion plans you have for this grant?
Good morning, Lisa Sherrick. For the record, I will have Dr. Woodard provide those details.
Thank you.
Stephanie Woodard for the record. Just to clarify the question, are you speaking of the emergency COVID-19 grant or the mental health and substance abuse block grants?
Actually, both, if you don't mind.
Sure, no problem. So the ER COVID-19 grant, we are continuing to do a lot of the work that was initiated in the original grant. As noted in previous testimony, the need for the services that were first funded under the COVID-19 grant has actually exceeded what was anticipated, and some of those subawardees were actually running out of grant funds far sooner than we had anticipated. So we are supplementing their funding to be able to continue with that care. That includes outpatient crisis triage, as well as supporting inpatient treatment for individuals who are underinsured or uninsured. And this is for children and adults. There's also some funding for positions to go to Crisis Support Services of Nevada. This can help to reduce the wait times for crisis calls and ensure that they are properly staffed to manage what they have seen is an increase in acuity to those calls. There are some positions that are funded through this grant, including those that are necessary in order to be able to properly administer the grant. So that's the COVID ER grant. Chair, would you like me to take any specific questions related to that or go on to the mental health substance abuse block grants?
Let me see if I have any members with questions about that. Yes, Assemblywoman Titus?
Thank you, Madam Chair. Dr. Woodard, do we have any more actually positions or providers that have been employed in some of these positions for access and wait times on some of these mental health issues? Is any of this funding going towards that?
Stephanie Woodard, for the record, yes. Actually, what we have seen with the funding in both Northern and Southern Nevada is that we have been able to provide some diversion from emergency rooms where we know that individuals, on average about 90 individuals on any given day are waiting for inpatient stays for psychiatric care. By providing the crisis triage as well as supplemental funding for inpatient, what we have been able to do is divert individuals from the emergency room to crisis triage, where they are provided a complete psychiatric evaluation and then referred to the most appropriate level of care, ensuring that only those who meet the level of care for inpatient are actually referred to that level of care. So they are working, these hospitals are working really across the networks in their region to make sure that where there are open beds available, those individuals are able to access that care, knowing that there is additional funding for care in the hospitals that have been funded for uninsured and underinsured individuals.
Hello, Madam Chair.
Go ahead.
So that's excellent news. Are we seeing, we knew that we saw certainly an uptick in mental health concerns with this pandemic. Are we beginning to see that level off, or are you still seeing the increasing that we had saw at the start of this pandemic?
Thank you, Chair, through you to Assemblywoman Titus. Stephanie Woodard, for the record. We're actually continuing to see a need for behavioral health services throughout the continuum of care and really throughout the state. As I have presented to this committee and other committees before, typically following major disasters, we don't see the surge in behavioral health need until approximately 12 to 18 months after the onset of the event. Most of the reason for that is many individuals have really healthy coping strategies that they can use to get through the disaster. However, the longer that a disaster is prolonged, as well as some of the other secondary and tertiary issues, such as financial instability, housing instability, and the like, can add to a breakdown of those coping strategies over the course of time, leading more and more individuals needing that behavioral health support. We've been very fortunate that we've had the Crisis Counseling Assistance and Training Program through FEMA and SAMHSA. This program has launched resilience ambassadors, just about 40 of them statewide, to assist individuals in linking to resources, as well as support for healthy coping and managing with the stressors directly related to COVID. This program is looking to end with funding come the end of June, but we are looking to strategize with all available funding to see how we can continue to supplement this program, because we found that it's been incredibly helpful in assisting individuals who need some of the prevention and early intervention services.
Thank you for that and all the efforts that you've been putting in for the state of Nevada and its citizens. And thank you, Madam Chair, for the questions.
Thank you. Senator Keycover? Senator Reddy?
Thank you for the opportunity, Chair. And I apologize, Dr. Woodard. I'm confusing things now. So if you could just help me sort it out a little bit in my head. So the crisis stabilization piece of this, how does that overlay with the other community-wide crisis stabilization efforts that we've been working on with the Crisis Now model? I'm not familiar with Signature Healthcare Services, or if I am, I'm not remembering that I'm familiar. So in the north, who is that? Where do they live? Just help me connect the dots, please.
Sure. Stephanie Woodard, for the record, through you, Chair, to Senator Ratty. This would be Desert Parkway Hospital down in Clark County and Reno Behavioral Health up in Reno. Both of these hospitals were actively engaged in providing 24/7 psychiatric triage care. So when we had discussed with them really the need for the continued services as well as expansion to help to offset the costs of uncompensated care, it was really a natural fit. And actually, I think it speaks directly to a lot of the work that we have been working on related to crisis stabilization services.
And so how are they getting, for in the north, for example, just because I'm more familiar with that one, what is the process for that person who's in crisis out in the community to get connected to Reno Behavioral Health? Are they going through the crisis call service now, or is it law enforcement, or how are we bypassing the emergency room in that particular model?
Through you, Chair, to Senator Ratty, Stephanie Woodard, for the record, it's really all of the above. So they have had a 24/7 psychiatric triage telephone line for quite some time to assist individuals in navigating to their front door for psychiatric triage. They're also being referred individuals directly from the Crisis Support Services of Nevada, as well as from emergency rooms. I do believe that they do some law enforcement drop-offs. This funding really was to help to expand what it was that they were already doing, recognizing that it was the uncompensated care piece that really needed to be addressed, so that anyone in crisis could be served in an alternative setting versus the emergency room.
Thank you. If I could just ask to get the numbers of people that have made it through this program, north and south, that would be fantastic. Thank you.
Assemblywoman Toles.
Yes, thank you, Chair. And my question hopefully is really a quick one. Dr. Woodard, you mentioned that we have about 90 individuals on a daily basis coming to the ER who could utilize these services. About how much do we see that number being addressed through this grant? Do we see, I would presume not all of them, but perhaps a drop in that number? If you could just let me know, that'd be great.
So Stephanie Woodard, for the record, through you, Chair, to Assemblywoman Toles. In Northern Nevada and in Southern Nevada, we're really seeing that it's not any one solution that's contributing to some of the lessened numbers of individuals waiting for emergency or waiting for inpatient beds through emergency rooms. So in addition to the psychiatric triage that we have up in Northern Nevada, a renowned hospital who has seen really the largest number of individuals waiting for inpatient has also simultaneous to this started an alert team through their emergency room. So it's a multidisciplinary team that really works to provide intensive case management and assessment to individuals with behavioral health issues that are coming to their emergency rooms. They have found that this has reduced the number of individuals that are waiting for inpatient beds because they are getting that psychiatric evaluation up front. And then the team is working with regional hospitals to be able to ensure that if someone meets that level of care, that transfer of care can be expedited as quickly as possible. Down in Southern Nevada, the relationship that the crisis response team through Las Vegas Fire and Rescue has had with Desert Parkway has been longstanding. So oftentimes when the CRT team is working with someone who's in a behavioral health crisis, they do the transport to Desert Parkway. Prior to these grant funds being available, that was at a significant cost to Desert Parkway because they were taking all individuals that were being dropped off by the CRT team. So this is helping to supplement some of that cost. There are a lot of other hospitals down in Southern Nevada that are very interested in being able to provide similar services, recognizing the need in the community, as well as some of the pretty significant cost offsets that there could be, especially for those hospitals that also run emergency rooms. So I would say, Assemblywoman Tolles, that it's not just this program, but I think it's a number of different programs, as well as the community really coming in alongside and supporting efforts around ensuring that individuals who are in crisis are receiving the most appropriate care.
You okay? All right. Assemblywoman Benitez Thompson.
Thanks so much. And so if I remember right, when we were having this conversation on the first hearing back on March 16th, this is the program we were talking about, where because we have this chunk of grant dollars, we're able to pay the provider who are taking these people their full rates, right? So if we're probably going to see good numbers, we're probably going to see things working right now because we've got these federal dollars. But once these grants expire, just like the last grant did, once these grants expire and we don't have them again, then we just go back to the Medicaid rates, which we know the providers aren't willing to take. So we should enjoy this while we have it and hope that maybe some more of these grant dollars come through. But otherwise, we know that we go back to the same old song and dance, which is our typical Medicaid rates. These providers that you're mentioning in the North and South, they don't accept these patients at the regular Medicaid rate. So we've got a good thing happening right now. It'll be nice to have some data to show us what happens when we can pay the full cost of care.
Thank you.
And Chair Stephanie Woodard, for the record, if I may just add a follow-up comment.
Go ahead.
Thank you. So through you, Chair, to Assemblywoman Benitez Thompson. Just to follow up on that, I do think that it's important, two things to call out here. The first is that for the inpatient rates, we actually are matching the Medicaid rate because we did not want to artificially inflate what an individual hospital was getting. And we would really have no basis for establishing that rate. So we are paying them a fee-for-service rate for those beds. But the second thing that I want to just mention is that the opportunities to expand access to inpatient beds do exist through 1115 demonstration waivers. There is a demonstration waiver that states can apply for, and a handful of states have applied for and have been funded, which removes the IMD exclusion. So in a state like Nevada, where we really have this hybrid system where a significant portion of our population is covered by managed care, but another portion is covered by fee-for-service, because we have so few non-IMDs in the state, we really lack access to care for those individuals who are fee-for-service. This becomes even more important, recognizing that the managed care organizations by contract currently do not cover the most vulnerable citizens, including those who fit within the age, blind, and disabled population. And certainly many individuals in Nevada who struggle with serious and persistent mental illness, including long-term psychiatric illnesses such as psychotic disorders, fall outside of managed care. So they do not have coverage under the 15-day in lieu of rule. This is incredibly important because what ends up happening is that for those individuals who have fee-for-service, there is really limited bed access for them to be able to receive the care that they need, because the majority of our psychiatric inpatient beds are actually in institutes of mental disease. So we do have some pathways forward in order to have some long-term solutions to be able to really alleviate some of these longstanding problems.
Any follow-up?
No, thank you. I just, I think that when we have these conversations, it's never about a willingness necessarily to do it. We've been working on different pieces of this puzzle for years to try to get to a place where we could even talk about diversions from ER and who can transport for diversions to ER and all of that. But I think that I think I heard something a little bit different than what I've experienced with the inpatient and the Medicaid rates and those folks who take the inpatient Medicaid rate. But if there's a trend change out there, then that's positive.
Okay. No response to that or any other discussion or comments? Okay, seeing none. Senator Ratty?
I would recommend the approval of decision unit E490 with the noted technical adjustment in fiscal year 2022 to increase SAMHSA COVID-19 grant authority to $2.1 million, to include a recent supplemental grant award with the grant being eliminated in fiscal year 2023, and the recommended budget amendment A215743-170, which adds $12.3 million in federal SAPTA and CMHS coronavirus relief funds to this budget in fiscal year 2022, and $8.7 million in fiscal year 2023, and would extend my gratitude to the staff for all of the extra COVID relief programs and work that's been done over the last year.
Thank you. A second? Second. A second from Assemblywoman Carlton. Any discussion? Seeing none, all in favor of the motion, please say aye. Aye. Any opposed? All right, moving on.
On page 15, the subcommittee will find other closing items. Other closing item number 5 has a technical adjustment which concerns the alignment of revenue sources associated with the position transfer. Fiscal staff recommends other closing item 1, 2, 3, and 4 be closed as recommended by the governor, and other item 5 be closed as recommended by the governor with the noted technical adjustment.
Thank you. Members, any discussions on the other closing items or questions? Seeing none. Senator Reddy?
I move that we close, that we recommend other closing items 1 through 4 be closed as recommended by the governor, and other item 5 be closed as recommended by the governor with the noted technical adjustments.
Second? Second. Motion's made by Senator Reddy, second by Assemblywoman Carlton. Any discussion on the motion? Seeing none, all in favor, say aye. Aye. Any opposed? Motion carries. Moving on.
Thank you, Chair. Moving on to the rural clinics budget, which the subcommittee finds from page 17 in the closing package on. There's one major decision before the subcommittee. The executive budget recommends reducing contracted psychiatric services and substituting general funds with Medicaid reimbursement revenues for general fund reductions of $1.2 million over the 2021-23 biennium. During the March 16th hearing, the agency stated that the recommended reductions would not result in any service reductions. Does the subcommittee wish to recommend general fund reductions of $1.2 million over the 2021-23 biennium, with reductions in contract expenditure authority of $972,642 and an offsetting increase in Medicaid reimbursements of $237,922 over the biennium?
Thank you so much. Members, any questions or comments for staff? Seeing none, Senator Reddy?
Thank you. I'd like to make a motion to recommend general fund reductions of $1.2 million over the 21-23 biennium, with reductions in contract expenditure authority of $972,642 and an offsetting increase in Medicaid reimbursements of $237,922 over the biennium.
Second? Second. I have a motion from Senator Reddy, a second from Assemblywoman Carlton. Any discussion?
Yes, Madam Chair.
Assemblywoman Carlton?
I just think it's really important to put on the record that it's been indicated by the agency that this particular recommendation should not have any direct effects on the service levels because there's some savings that has been allocated to some of this over the years. So hope we would have a much deeper conversation if we thought that this was going to impact service levels, but it's been indicated that it will not. I just thought it would, when people see a cut to rural health services. I just wanted to make sure that the record is complete. Thank you.
Thank you so much for getting that on the record. Members, any other discussion? All right, seeing none. All in favor of the motion, say aye. Aye. Any opposed? Nay. We have one nay. I believe that's from Assemblywoman Tyus. Correct? Thank you. Motion passes. Moving on.
There are a number of other closing items, which the subcommittee finds on page 19. Other closing item number 7 is a technical adjustment to the base budget. It consists of revenue offsets. Higher than initially projected non-general fund revenues result in general fund reductions of $240,584 in fiscal year 2022, and lower than initially expected non-general fund revenues in general fund increases of $59,003 in fiscal year 2023. Fiscal staff recommends other closing items 1, 2, 3, 4, 5, and 6 be closed as recommended by the governor. Other closing item 7 be closed as a technical adjustment, and request authority for staff to make other technical adjustments as necessary.
Thank you so much for that. Members, any questions or comments? Seeing none, Senator Reddy?
I make a motion to recommend other closing items 1 through 6 be closed as recommended by the governor. Other closing item 7 be closed as a technical adjustment, and request authority for the staff to make other technical adjustments as necessary.
Second? Motion and second by Assemblywoman Carlton. Any discussion on the motion? All in favor, say aye. Aye. Any opposed? Motion carries. Moving on.
Thank you, Chair. Christian Tau for the record. The next budget on the agenda is Northern Nevada Adult Mental Health Services from page 21 in the closing package on. There are 2 major decisions for the subcommittee to consider. The first major decision concerns the reduction in general fund appropriations of $389,399 for community-based living arrangement services in fiscal year 2022. Full funding levels will be reinstated in fiscal year 2023. During the March 16th hearing, the agency mentioned a shortage of CBLA homes in northern Nevada, resulting in the inability of the agency to expand its full program funds. The recommended reductions would thus not result in any service reductions. Does the subcommittee wish to recommend reductions in general fund appropriations of $389,399 for the community-based living arrangement program in fiscal year 2022?
Assemblywoman Carlton?
Thank you, Madam Chair. And in going over this and trying to evaluate where we are, we know there have been issues with the CBLAs, and it's a number of them are not operating any longer for multiple reasons, not for any particular one. In looking at the reduction in the first year of $389,399, that leaves them with a base of Mr. Thauer that was what, like $689,000, something along that line, if I remember correctly.
Chair, through you to Assemblywoman Carlton. The amount would be reduced in fiscal year 2022 to $693,139,000 for CBLA homes.
And that would be the same amount in the following year, and then restoring the 389 in the following year. So the base is 693,000 in the following year also?
No, the base, and so the reduction would only apply to fiscal year 2022. In fiscal year 2023, funds would be restored to the base level of $1,082,000. I apologize. About $1.1 million.
About 1.1 million. So, with the need that's out there, I'm just concerned that we're adding money in the second year that may not necessarily be needed. We know that in the first year, they can draw down the money from the second year, correct? So it's a 2-year biennium. They have the money the first year. They can draw the money down the second year if they would need to. And if we did not approve the addition of the $389,399, they could submit a work program if the funds were needed, if these CBLA homes come back, to IFC to be able to pull those dollars down. We wouldn't necessarily need to put it in a restricted fund. It would just be available as any other work program would be if caseload increased. Is that correct?
I'm not sure I understood which funds you would wish to put into the IFC contingency fund. Would that be
No,
for fiscal year?
there would be no funds, and I apologize, there would be no funds put into the IFC contingency account. They would just have a typical work program like any other program would, and they would submit that.
Right. So correct. If the agency would have savings in other categories, for example, personnel or other expenditure program categories, these savings could be transferred via work program to this category to fund a potential increase in CBLA home needs. Otherwise, if they would run out of funds, they would have come before the Interim Finance Committee to ask basically for additional funds from the contingency fund.
Okay, thank you. And I appreciate that. And, you know, we all want to support these funds, and I have no idea where anybody else on this committee is on this one. But I'm just looking at some of the others, knowing that, you know, there's a lot of gives and takes in a lot of these budgets. And we're going to probably run into a couple that are going to be $300,000, $400,000, $500,000 more than what we originally thought. So I'm just trying to think ahead and think, where can we possibly set a few dollars aside as we move through all these so that when we get to the very end, we can get there. I just wanted to make sure that we had a thorough conversation about it and everyone understood exactly where we were going with that. So, Madam Chair, thank you for the latitude to have a full discussion.
And thank you so much for the questions and the explanation. Senator Reddy.
Thank you. And I do think this one's unusual how it's been budgeted. We've seen a lot of like holding something vacant in the first year and then going to the second year and having it increased. But this one's a little bit different. So I know that the CBLAs have been through quite a journey. And so I would like to hear from staff why the lower number in the first year, and then do you have confidence that those services would be available in the second year? What is happening in the northern, because this is the Northern Nevada budget, why was it budgeted that way?
So
Good morning, Lisa Sherrick. Oh,
I'm sorry. Well, whoever has the best information on the community-based living arrangements.
If you want the agency.
From the agency, yes, sorry.
good morning, Lisa Sherrick, for the record. Yes, we are confident that we will be able to maintain the services through FY22. The reduction was in only FY22 to meet the reduction that we needed to provide. And fortunately, we did not need to take that reduction in the second year. And that is why we made that decision.
So, if I may, so Ms. Sherrick, if I could ask you to elaborate a little bit more, because I think the concern here is that's a pretty significant jump from year one to year two. And so we're wondering about the level of confidence that there will be that many more placements to be able to use that money. So do we have enough CBLAs? Do we have them licensed? Do we have them certified? How are we absorbing that significant of a cut in year one and being able to make that significant of a jump in year two?
Lisa Sherrick, for the record. So we can always use more CBLAs. I think that's a fact that we can realize throughout the state. While we are able to maintain the current individuals in services right now, there is always the potential that there will be additional people looking for services in the coming years. For example, we actually do have 2 individuals potentially looking for CBLA services, that while we do believe we can fund a placement for them, it may be very tight for our budget. So I do anticipate those additional funds in the second year being helpful to ensure that we can serve all individuals that may need that service should it arise.
Thank you so much for that answer, but I'm going to ask you to go into a little bit more depth. There were a lot of should-haves, would be, hopefully it's going to happen kind of thing. We're looking at $1 million in that second year. Would it have any negative impact on your division if you would have to come back, if you do see that you have an increase of need for service that you don't have now and you wouldn't have in that first year, but you saw it in the second year to come back with a work program to access those funds when those funds are needed instead of tying those funds up now?
Good morning, Jill Millay for the record, Chair and Committee. So when our CBLAs in Northern Nevada have seen a decrease in our caseload, I did want to point out that you do need to be in the services with NAMS in order to get into CBLA homes. And we have seen a decrease in our caseloads there at Northern Nevada facilities. With that said, though, we fortunately will not displace anyone in FY22. We've been working really hard communicating with those providers. Sometimes they call us and they're concerned about, can I continue to maintain these homes? We go in, we work with them very directly because we know that we need those providers. We also try to recruit for new providers as well to meet the demands. Although in the north, the demand in the caseloads anyway, haven't increased projections anyway for FY23. So along with the projections, the need to be part of NAM services to get into a CBLA home and staff working very hard with those providers. We are hopeful that we can bring on more providers and not lose any more in FY23. I hope that answers some of your questions.
It does. Senator Reddy?
Thank you, Chair, for the second shot. So is the current state then nobody who needs a new placement will get a new placement in 2022 because those are all full and there's no additional revenue? So you're saying with this cut, we're not going to have to displace anybody, but does that also mean nobody else is going to get a new placement?
Lisa Sherrick for the record. So unless individuals attrition out of the program into another service area or move out of state, that would be the only time that there would be availability, correct?
So if an individual on July 1 needs supportive housing, has a serious mental illness and needs supportive housing, where are they going to go?
Lisa Sherrick for the record. I don't have the specific answer of where that person would go. However, we would work with the community to see what options would be available. I believe in the behavioral health budget presentation on the 16th, I did indicate that there would be 7 to 9 individuals that would not be able to access services should we continue to stay flat with people staying in services. But we would do whatever we could to have them work with the community to find something. Although I obviously cannot give you the assurance that there would be housing for that person or people.
So then why didn't we budget this, instead of having the entire cut in the first year and having such a big jump up, why didn't we budget the cut across both years so we would have some little bit of capacity for growth in year 1 and be able to maintain that in year 2?
Lisa Sherrick for the record. So we did originally propose cuts in both years. However, it was just FY22 that ended up in the governor's recommended budget.
Assemblywoman Carlton?
Thank you. And thank you for the follow-up, Madam Chair. So in the conversation that we just had about possibly 7 to 9 folks not having placement, is that lack of placement due to no beds available, or is it due to funding? Because it's my understanding you can pull the second year down into the first year, so funding should not be the issue. The issue is actually that there are no beds available. Is that correct, or did I misunderstand?
Okay.
Sorry, Debbie Reynolds for the record, Deputy Administrator. I don't believe we can pull funds from the second year into the first year unless the committee chooses to add language to the Appropriations Act to allow that ability. But that would certainly be helpful if we could do that.
So that may be where I'm misunderstanding it, and it was part of the conversation earlier with staff. So, Madam Chair, if that's one of the options we would need to use, but the question actually was, and thank you for clarifying that, but the question actually was, if there were funds available, is there a placement available? Are there open slots?
Jill Millay for the record. We do have some limited, sorry, I'm hearing feedback. My apologies. We do have some limited bed availability. We do not have funding.
Okay, that's what we really need to get to be able to make some of these decisions. So, Madam Chair, I mean, in a number of different budgets, we do have that option. I don't want to throw staff under the bus, but if I could ask Mr. Leiser possibly, if you would allow.
Thank you, Madam Chair. For the record, Brody Leiser, Fiscal Analysis Division. Assemblywoman Carlton, I apologize if we did not make something clear earlier. There typically is language in the Appropriations Act that allows for certain budgets to transfer funds between fiscal years. I believe I have the section of that, the 2019 Appropriations Act up, and do not believe that the Northern Nevada Adult Mental Health Services budget is one that was included for the current biennium. However, if the subcommittee chose or had a desire to make that recommendation to the full committee, and the full committee's approved to include this budget account in that section of the back language, that would allow this budget to have the authority then to transfer funds between fiscal years as you described, with the approval of the interim finance committee and upon recommendation of the governor.
And thank you, Madam Chair, and thank you, Mr. Leiser, for making it very clear. It's hard to remember which ones are allowed and which ones aren't, but I firmly believe that anytime you're dealing with people and caseloads and you never know where you're going to be, and because of the way we do our budgeting over a 2-year period, we want to make sure that someone isn't left out in the cold in June just because it's not the 1st of July, that there are dollars waiting there and we can't do anything for them simply because the calendar isn't working for them. So I would suggest to the committee that in this particular case, because this is real people who are being impacted, it's not just a paper money change, that we have a discussion about allowing the dollars from the second year to be drawn down into the first year. I still have concerns about adding the amount in the second year. I'm not sure where the caseload's going to be. We're looking at very tight times right now, but I think definitely letting them pull the money down to address any issues in the first year, I think would be the best thing to help the folks who are going to need the help with this program. So I would be comfortable with that recommendation moving forward.
Thank you, Assemblywoman Carlton. I know we have one more question and comment from Senator Keycover.
Thank you, Madam Chair. So, Mr. Leiser, is it generally when we authorize those transfers in the Appropriations Act, it's budget account specific, right? So you'd be looking at potentially adding it for 3162 as an entire account, or specifically for this expenditure category?
For the record, Brody Lizer, Fiscal Analysis Division. Madam Chair, through you to Senator Kekeffer. I believe that the section of the bill that I'm looking at is budget account specific. And so, yes, this would, if consideration was given, this would add the budget account to that section. However, I believe that if the desire was to limit the ability to transfer funds between fiscal years solely for the purpose of supporting the community-based living arrangement services, that language could be drafted to restrict the transfers that are allowed for that specific purpose.
Thank you, Mr. Lizer. Appreciate that. Madam Chair, I'm a little nervous about providing that authority for the entire budget account, knowing how big it is, right? We're running a hospital, we're running CLBAs, we're running jobs and day training, or maybe not JDT, but there's a lot in this budget. So, I mean, basically we'd be, if we were to do it, I would worry that we're creating basically a budget that reflects 2 years of expenditures that allows them to spend it kind of whenever they want. And I think we really still need to keep focusing on year at a time. So for a specific expenditure category, it seems to make a lot of sense, but I would worry about doing it for the entire budget account.
Senator Reddy?
Thank you, Madam Chair. And so I'm also wondering if at the full committee, we could consider leveling out the money over the 2-year period. So what I'm wanting to understand is, so it's not a net increase to the biennium budget, and I don't think at that dollar amount it would create a cash flow problem, but I would like to be able to, perhaps offline, understand that a little bit more. Thank you.
Thank you. That can be an offline conversation with you and fiscal staff to get the answers to those questions. So any other discussion on this item before I call for the motion? And
Madam Chair, if I may, I think Senator Kekeffer brought up a very good point. I was strictly focused on this particular issue because this is, dealing with these folks and being able to have the resources to address them and not have the calendar work against them, I think is very, very, very positive. I understand where he's coming from. I'm not going to open that barn door on my way out of this building. So that would be a mess for the folks behind us to have to try to close that door again. So I wouldn't do that to you, Madam Chair. But I do agree for this particular account dealing with these folks in need, that would be good. And I would be more comfortable with the addition of the $389,000 now with the conversation about being able to draw it down into the first year, which in essence would give us the leveling effect if we needed it, without having to use dollars in 22, which are not available. So I would be comfortable with that.
is that a motion?
Yeah, I just have a process question. So do we close it today with the language that we have, and then if there's any adjustments we need to make, we would do that at the full committee? Or do we close it today with within the motion saying add just this budget account to the?
Madam Chair, if I may, it's much easier for staff if we do the work here in the subcommittee budget closings, and that way when it's reported to full committee, there's less work to be done at the full committee level. We will just receive the report from the subcommittee. We would agree and move forward. Otherwise, if we leave it for that second step, it makes that second step a little bit longer. So if we can address it today and everyone's comfortable with it, that just makes things smoother when we hit crunch time.
I think I can craft that motion. I just have one last sort of process question. So just to make sure that I understand, if we put that language in the Appropriations Act, then they have to come back to IFC and say, we need that money.
Mr. Lizer?
For the record, Brody Lizer, Fiscal Analysis Division. As the language currently exists, yes, it does require IFC approval. And So as I understand this, Senator Ratty, and if this helps with the potential motion, the recommendation would be to recommend the reductions in general fund appropriations of the $389,399 for the community-based living arrangement program in fiscal year 2022, and that the subcommittee recommends the inclusion of back language that allows for transfers between fiscal years in the Northern Nevada Adult Mental Health Services budget, specifically for the purposes of community-based living arrangement services, upon approval from the interim finance committee and upon the recommendation of the governor.
Yes. So moved.
The second?
Second.
It's been moved by Senator Ratty and second by Assemblywoman Carlton, the motion as detailed by fiscal staff. Any discussion on the motion? Seeing none, all in favor of the motion, say aye. Aye. Any opposed? Motion passes. Moving on.
Christian Tauer, Fiscal Analysis Division for the record. The second major decision concerns caseload projection-based staffing reductions in the closing package from page 23 on. Caseload projections are usually updated in March during legislative session to allow for the inclusion of recent data, January 21 and February 21 caseloads, for as accurate as possible caseload projections. During the March 16th hearing, however, the agency indicated the need for a thorough revision of its caseload analysis beyond the usual data update. Caseload data for some outpatient programs had, according to the agency, not been reported correctly in the past concerning approved staff-patient ratios, with the effect that some programs were effectively overstaffed and others understaffed. On March 29th, the agency provided an updated and revised caseload analysis to correct the previous errors. In the top half of page 21 of the closing package, the subcommittee will find a table summarizing the decisions before the subcommittee. The column on the left-hand side, entitled The Executive Budget, includes the recommendations for caseload-driven position eliminations in the executive budget. Right next to this column is a column entitled Revised Agency Recommendation, which includes the adjusted caseload-driven position eliminations based on the March 29 caseload analysis revisions. Whereas the executive budget recommended eliminating 4.02 full-time equivalent positions, the technical adjustment based on the revised caseload analysis before the committee would eliminate 5.02 positions. Does the subcommittee wish to recommend the elimination of 5.02 full-time equivalent positions to account for a decrease in caseloads in several outpatient programs, resulting in a reduction in general fund appropriations of $1.1 million over the 2021-23 biennium?
Thank you. Members, any questions or discussion on this budget closing item? Assemblywoman Benitez Thompson.
It's just a quick observation. I think we, from my notes, had some conversation about it during the subcommittee hearings. But I think the numbers on the medication clinic have changed just a little bit since that March 16th hearing and dropped lower. So I'm just noting for the record the difference in the downward trend for our Northern Nevada medication clinics, but then in the south we see the exact opposite happening, kind of a steeper upward trend. And I don't know if data can tell us any reason why more about that, or I'm sure it's a number of different reasons, but just noting it for the record is something for us to keep our eye on.
Do we have anyone from DHHS that could shed a little light on that comment?
Madam Chairwoman, if it's okay, I just wanted to note it for the record as kind of more something to just mindfulness to watch as we watch these trends. I don't know if it's a one-off. I don't know if there's server provider issues or other things happening respective to the community. The population tends to be the population, so I don't know that it may be there. I think on this though, I did want to just make one other comment I had, and it was with the staffing. So of course, really, I'm glad that there's been a look at the staffing and the positions that are needed. I think the one thing that I wanted to put on the record and hear from the division was just a little bit more on if we're doing a reduction in some of these positions, like the psychologist 1 or the psychiatric caseworker 2, with projected average caseload in 2023 being about 66 people and the staffing ratio now being 1 to 35. I think that means that there will just be 1 or 2 people in any of these positions, and so wanted to know if that was going to be sufficient just for coverage for people taking time off. If you're the only psychologist that's there, do you know, how does that work for meeting patient needs when you just have a staff of 1 or 2? Or is there more flexibility that we should know about and have on the record to help us keep in mind covering patient needs?
Good morning, Jill Millay for the record. Thank you for that question. And yes, both positions actually have some flexibility. When we looked at particularly psychiatric caseworker, those are unlicensed positions, but they do have flexibility to move without programs. When we looked at the reductions for the caseload, particularly in FY23, we did round down so that we could have a little bit more coverage of psychiatric caseworkers for any kind of unexpected absences to meet that caseload. So that did help us. The psychologist is very flexible as well, mostly seen in counseling services. And we did see a slight decrease in that area.
Thank you. Any other discussion or questions? Seeing none, Senator Ratty.
I make a motion to recommend the elimination of the 6 5.02 FTE positions to account for a decrease in caseloads in several outpatient programs, resulting in a reduction in general fund appropriations of $1.1 million over the 21 to 23 biennium.
Thank you. Second? Second. A second from Assemblywoman Carlton. Any discussion on the motion? Seeing none, all in favor of the motion, say aye. Aye. Any opposed? Aye. 1 in opposition, it's Assemblywoman Titus. Motion passes. Moving on.
Kristen Tower, Fiscal Analysis Division for the record. On page 25, the subcommittee will find other items. Other closing item number 8 has a technical adjustment to an agency-specific inflation factor. Other closing item number 9 is a technical adjustment to the base budget. Based on updated revenue projections for non-general fund revenue sources in this budget for the 21-23 biennium, fiscal staff recommends revenue offsets resulting in general fund reductions of $433,982 in fiscal year 2022 and $435,002 in fiscal year 2023.
Members, any questions or discussions on the other closing items? Senator Kiekefer.
Thank you, Madam Chair. And I apologize, Mr. Tower. What the transfer of the senior physician to HICFAP, I'm sure it was presented, and I'm sure I just forgot. What is that position, and why is it moving over to Medicaid?
You can go ahead.
I believe this position deals in particular with Medicaid issues, and I believe during the hearing, the question was raised whether this could be a pharmacist, and the agency provided an answer that this position has to be basically a senior physician in order to be transferred.
Senator Kiefer, did that answer your question? Okay. Any other discussion on the motion? Or any other discussion? All right, seeing none.
I'd make a motion to recommend other closing items 1 through 7 be closed as recommended by the governor. Other closing item 8 be closed with noted technical adjustments. Other closing item 9 be closed as a technical adjustment, and request authority for staff to make other technical adjustments as necessary.
Thank you. Second? Second. It's been motioned by Senator Rowdy, second by Assemblywoman Carlton. Any discussion on the motion? Seeing none, all in favor of the motion, say aye. Aye. Any opposed? Motion passes. Moving on.
Thank you. Moving on to Southern Nevada Adult Mental Health Services budget, which the subcommittee finds from page 29 on. 2 of the 3 major decisions concerned caseload-driven staffing adjustments. The agency also identified the need for caseload analysis revision for programs of Southern Nevada Adult Mental Health Services. Major decision number 1 concerns caseload-driven position eliminations. On page 32, the subcommittee will find again a table summarizing the results of the revised caseload analysis as concerns position eliminations. The executive budget recommends the elimination of 5 positions to account for projected decrease in caseloads in the justice-involved diversion program, resulting in general fund reductions of $903,756 over the upcoming biennium. The revised caseload analysis as of March 29th found that, large and by, the justice-involved diversion program is actually not decreasing, but increasing caseloads. However, there were also individual programs that were, due to staff-patient ratio errors, overstaffed. Resulting in total is the need for 2.0 full-time equivalent position eliminations. The difference between the executive budget and the adjustments based on March 29 revisions is thus that whereas the executive budget recommended the elimination of 5 positions, the adjustment recommends elimination of 2 positions. In dollars, this difference adds up to $566,377 over the biennium. Does the subcommittee wish to recommend not approving Decision Unit M201, approving Decision Unit M203 as recommended by the governor, and approving Decision Unit M204 as recommended by the governor with a noted technical adjustment to eliminate only 1 position for a total 2 position eliminations, resulting in an increase of $566,377 in general fund appropriations compared to the amount recommended by the governor, for a net amount of $337,379 in general fund reductions over the 21-23 biennium.
Thank you. Senator Rowdy?
All right, I have a motion to recommend not approving Decision Unit M201, approving Decision Unit M203 as recommended by the governor, and approving Decision Unit M204 as recommended by the governor, with the noted technical adjustment to eliminate only 1 position for a total of 2 position eliminations, resulting in an increase of $566,377 in the general fund appropriations compared to the amount recommended by the governor, for a net amount of $337,379 in general fund reductions over the 2021-23 biennium.
Second? Second. I have a motion from Senator Rowdy, a second from Assemblywoman Carlton. Any discussion on the motion? Seeing none, all in favor of the motion, say aye.
Aye.
Any opposed? Motion passes.
Thank you. Christian Tau for the record. Major decision number 2 concerns caseload-driven position additions. This decision unit M205, was not included in the executive budget. The need for the addition of positions is primarily due to updated caseload projections in the medication clinic, which increased in view of recent caseload data. As you can see on the graph on page 33, caseloads in the medication clinic have decreased in the context of coronavirus restrictions. They are projected to grow gradually through fiscal year 2022 and fiscal year 2023. The need for additional 4 positions due to caseload increases exists in 2023 only. Fiscal staff would note that any projection for fiscal year 2023 involves higher than usual levels of uncertainty, given that it cannot be known how the situation as concerns coronavirus-related restrictions may develop. Does the subcommittee wish to recommend approving the addition of 4 positions and $580,690 in general fund appropriation dollars to the medication clinic program in fiscal year 2023? And then, given the uncertainty concerning caseload projection in fiscal year 23, if the chair wishes to do so, the subcommittee could consider if the subcommittee wishes to approve the addition of $580,690 to fund 4 new positions. But if it prefers to wait until additional caseload experience demonstrates whether all or just 1 or 2 of the positions are warranted, the subcommittee may wish to approve the funding and recommend that it be placed in the Interim Finance Committee contingency account, whereupon the division could request the amount of funding needed based upon actual caseload need.
Thank you. And I believe Mr. Leiser has some additional information. Mr. Leiser?
Thank you, Madam Chair. For the record, Brody Leiser, Fiscal Analysis Division. I'd just like to acknowledge the work that Mr. Tower has been doing and thank him and the agency staff, as well as the Governor's Finance Office, to work through a number of these caseload items that you've heard about today. Ideally, your fiscal staff works with the agency and the Governor's Finance Office in an effort to ensure that the budget decisions that are presented to you are sound in nature. And ideally, we all get on the same page, but that does not always happen. So I just want to make the subcommittee aware that we did receive email communication just prior to the start of the hearing this morning, and that the Governor's Finance Office was not in agreement with this decision point that is presented in your closing document, and believe that they would like to have additional discussion as to whether or not this decision point represents a correction to an error in the caseload as presented in your closing document, or represents a new caseload consideration that should be vetted through the normal budget process. So, Madam Chair, the subcommittee may wish to approve the decision point as presented in your closing document on page 33, not approve the decision point that's presented in your closing document, or alternatively, the subcommittee could defer the decision point to the full committees when staff presents the subcommittee's recommendation for the Division of Public and Behavioral Health.
Assemblywoman Carlton.
Thank you very much,
Thank
Madam
you,
Chair.
Mr. Leiser.
So, Mr. Leiser, if I'm understanding you correctly, some work was done on caseload adjustments, and we got numbers that we thought would substantiate this, but there's a bit of a disagreement on actual caseload right now. Am I understanding you correctly, or if you could just kind of restate it? I missed a couple pieces there, I think. I just want to make sure that I have a full understanding of what's actually being requested of us by the GFO.
Thank you. For the record, Brody Leiser, my understanding is, based on the limited information I have, is that the Governor's Finance Office believes that this may represent a new approach with this caseload decision in terms of the staffing ratios. as compared to a technical correction or a correction to an error in the existing approach. And as such, if it is a new caseload consideration, they feel that this is something that should go through the normal budget process and budget cycle for consideration. I hope that answers your question.
I think I can read between the lines. Thank you very much.
Senator Kiefer?
Thank you. And Mr. Lazar, I know you're in a tough spot to answer a question that should be probably posed to somebody else, but so what's in dispute is the staffing ratio for the medication clinic.
Yes, that's my understanding.
Okay, and the new calculation suggests that it had been understaffed, or I'm sorry, overstaffed? Understaffed.
I believe that the clinic would be understaffed, and as presented in your closing document, the funding that is presented on page 33 would add the $580,690 to fund 4 positions in fiscal year 2023 to fully staff the clinic.
And when you say something should go through the normal budgetary caseload process, that means next biennium, right? When people are sitting here in 2023?
I believe that is what was referred to. However, I do not want to speak for the governor's finance office. I believe that if the subcommittee were to take a motion to defer this action to the full committees when the division's budgets are presented to the full committees, that would allow your fiscal staff time to get together with the governor's finance office staff to have a clearer understanding of the concerns that they raised this morning.
Thank you, Mr. Lazar. I appreciate it.
Thank you, Mr. Weiser, and thank you all for the comments and the questions. I believe Assemblywoman Benitez Thompson has a comment.
Thank you so much. So I don't see it mentioned here, but I did see it mentioned in the Northern Nevada one, is where we actually have the reference to the ratio, I think, of 1 to 35. And so if we've got, I guess, issues with the ratio, then we're probably going to have it in at least our Northern Nevada budgets as well. I would imagine, although the one there led to the elimination of 6 and this one's leading to the addition of 4, and then once again going back to that reference of we see a decline in one place of a patient utilization of the clinic and then an increase in another place of the patient utilization of the clinic. But I don't know if we need to take into consideration, it seems to me it would not make sense to have a different patient to staff ratio for one region than for another region. And so I imagine, do we need to rethink the action that we took for Northern Nevada as well, if we're going to rethink ratios?
Well, members, in light of the additional information we received this morning and the discussion that we have just had on this budget closing item, I would move for a motion to defer this to the full committee so that our fiscal staff has an opportunity to have a discussion with GFO, and as a full committee, we can make the decision at that time.
Second. I'm sorry, I heard you say I move, so I can do it. I'll move that we defer this decision to the full committee.
The motion to move this to our full committee was made by Senator Ratty and second by Assemblywoman Carlton. Is there any discussion on the motion?
And thank you, Madam Chair. And the comments made by Majority Leader Benitez Thompson, if staff needs to bring back to us any other changes that would need to be made at full closing to make other adjustments as necessary. Thank you.
Thank you. Any other comments? Seeing none, all in favor of the motion, say aye. Aye. Any opposed? Motion carries. Moving on.
The subcommittee will find major decision number 3 on page 34 of the closing package. It concerns office space elimination for general fund reductions. The executive budget recommends office space eliminations for general fund reductions of $76,871 in fiscal year 2022 and $78,987 in fiscal year 2023. That the subcommittee wish to recommend approving the elimination of office space for general fund savings of $76,871 in fiscal year 2022 and $78,987 in fiscal year 2023.
Members, any discussion? I'll call for the motion.
Move to recommend approving the elimination of office space for general fund savings of $76,871 in fiscal year 2022 and $78,987 in fiscal year 2023.
A second? Second. Any discussion on the motion? Seeing none, all in favor of the motion, say aye. Aye. Any opposed? Motion carries. Moving on.
On page 34, the subcommittee finds other closing items. There's one technical adjustment to an agency-specific inflation factor. Fiscal staff recommends other closing items 1 through 6 be closed as recommended by the governor, and other closing item 7 be closed with a noted technical adjustment, and request authority for staff to make other technical adjustments as necessary.
Thank you so much for that. Members, any questions or comments? Seeing none, I'll call for the motion.
I move to recommend other closing items 1 through 6 be closed as recommended by the governor, and other closing item 7 be closed with the noted technical adjustment, and request authority for staff to make other technical adjustments as necessary.
The motion from Senator Reddy, a second from Assemblywoman Carlton. Any discussion on the motion? Seeing none, all in favor of the motion, say aye. Aye. Any opposed? Motion carries. Moving on.
Thank you, Christian Tower, Fiscal Analysis Division, for the record. Chair, I will now begin presenting the budgets which the subcommittee has not previously reviewed for the Division of Public and Behavioral Health, and for which fiscal staff is responsible for the developing closing recommendations. I will pause following my presentation of each budget to allow for questions. When I have presented the last budget in this group and questions have been addressed, the chair may wish to ask for a single motion for closing consideration on all of the budgets for which fiscal staff is responsible for developing recommendations. The first fiscal staff closed budget is on page 37, the alcohol tax program. There are no major closing issues and no other closing items in this budget.
Members, any questions? All right, moving on to our next budget.
Next staff closed budget is the Facility for the Mental Offender on page 39. There are 5 other closing items on page 40, with one technical adjustment of other closing item number 5 concerning agency-specific inflation. And that would finish the presentation of this budget.
Members, any questions on this budget, 3245? All right, seeing none. You can go ahead.
The decisions before the committee are on page 41. Fiscal staff recommends that the following budgets be closed as recommended by the governor, and request authority for staff to make technical adjustments as necessary. For budget 101-3255, the alcohol tax program, and for budget 101-3645, the Facility for the Mental Offender, with closing item number 5 closed with a noted technical adjustment.
Senator Reddy?
So moved.
Second. It's Been moved by Senator Ratty, second by Assemblywoman Carlton. Any discussion on the motion? Seeing none, all in favor of the motion, please say aye. Aye. Any opposed? Motion carries. And members, that brings us to the last item on our agenda, and that is public comment. We actually have a few guests for us in the audience, so if you'd like to make public comment, you can come up to the witness stand. If there's anyone joining us by Zoom or telephone, if the BPS can let the public know that we are available for public comment. Do we have anyone on the line, the telephone line, for public comment this morning?
Chair, the public comment line is open and working. However, we have no callers at this time.
Thank you so much. And although we do have guests in our audience today, it's so nice to see a live person here. Thank you for joining us. It appears we do not have anyone for public comment by phone, by Zoom, or in person. I'd like to thank our broadcast staff for all the work that you do, our amazing staff here in the committee room with us. And for committee members, thank you, and this meeting is adjourned.